The next bill on the calendar for the day is Senate File 3204. The clerk will report the bill.
Senate File number 3204, number 1 on the calendar for the day, an act relating to state government, the first engrossment.
There are no amendments at the desk. Is that right? The clerk will give the bill its third reading.
Third reading, Senate File number 3204.
Third reading. I recognize the member from St. Louis, the author of the bill, Representative Olson, to explain the bill.
Thank you, Madam Speaker. Senate File 3204 updates the section of statute that governs the Public Employee Insurance Program, also known as PEEP. This is a voluntary health insurance pool school districts, cities, and county employees can opt to join and has been in existence since 1989. This pool currently contains 289 groups within it, which equates to coverage of 17,000 employees and 35,000 lives. 20,000 of those insured lives are through school district employees who have opted to be in PEEP. As we know, health insurance costs are skyrocketing, and we need to look at any way we can to weather this storm for our communities. The Kaiser Foundation estimates healthcare costs will increase on average between 7% and 8% in 2024. For our schools alone, this is an enormous cost and is draining the important investment we're making in public education. PEEP is a solid option to take care of our employees, and more districts and municipalities will opt in as improvements are made to the plan. In January of this year, MMB, the agency that administers the PEEP program, conducted an analysis of the pool structure compared to other states with similar health insurance pools for public employees. This bill increases the number of years groups are required to participate in the pool, moving the timeline from 2 to 4 years. This was one of the recommendations from the report. The second change this bill makes is to lower the threshold for groups to exit the pool if their premiums reach 20% or higher. Currently, the threshold is 50%. The more stable the pool, the lower the costs. Passing this bill would be a step toward providing stability for employee groups who opt to be in PEEP and for our public school budgets. Stability to the pool means lower health care costs for employees and for the state. And with that, Madam Speaker, I ask for member support.
The member from Hennepin, Representative Nadeau.
Thank you, Madam Speaker. Thank you, Representative Olson. You know, this bill, the bill is a reaction to legislation that we put into effect in 2014, where it required, where there was an expectation that frequent bidding every 2 years by local governments for public employee health insurance coverage was going to be necessary to drive down the cost of insurance to employees, to employers, and ultimately to the taxpayers who pay for this. You know, the decade since that time, this is shown to be true in some respects. And as Representative Olson indicated, perhaps it's come at a little bit of cost of stability to some of our local governments that pool their insurance coverage through PEEP, other cooperative arrangements, and simply through health insurance carrier arrangements. When we heard this bill in committee, we had a really good discussion about the importance of market stability. And I was pleased to hear that representatives that brought this bill forward were supportive of these longer-term options and opportunities and arrangements that for their health coverage, regardless of where it's purchased. This bill, the one that we're hearing today, literally will impact about 17,000 people, between 10 and 20% of our public employees. And the legislature really needs to consider expanding the longer-term coverage options of the tens of thousands of other school employees and their dependents. Today's bill creates a unique opportunity for some, and I think we need to be prepared to consider similar actions for all. And so I will be picking up this mantle, hopefully, next year, if I come back and make some modifications so that we can ensure that we have an even playing field, a stable environment, increased stability for, for all of our public employees in their health care program. So with that, thank you, Madam Chair. I will be voting green, and I recommend everyone do so.
Any further discussion to the bill? The member from Morrison, Representative Grisha.
Thank you, Madam Chair. And members, the devil's in the details. And when you look at the Health Insurance Transparency Act that was passed, And we can say this is free market and all that. I probably got that wrong, didn't I?
Well, you got it.
The problem with this is it is not an open market. It is not, that is not the way this is set up. A school district, unless you are exempt as a self-funded school district, you must get a PEEP bid. Okay, that is a must. That is not open market. And we can say, oh, it's had to be propped up a little bit. This is going to continue to be subsidized more and more by taxpayers because it tips the scale in favor of PEEP, and as the loss controls come in there, the costs are going to rise. So members, don't get caught thinking this is a nice, shiny object. It's a great thing. It's going to solve all the problems. If it solved all the problems, we wouldn't be mandating schools to have to get a PEEP bid. And so, and if this was such a great bill, why are not these self-funded schools mandated to look at this option? And I'll tell you why. It's because they negotiated themselves out of this so that they didn't have to be bid by the PEEP rules. So I'll be voting red on this, and if this continues to come up, I'll continue to push back.
The member from Stearns, Representative O'Driscoll.
Thank you, Madam Speaker and members. Madam Speaker, I'm going to ask if the bill author would yield to a question, please.
She will yield. Representative O'Driscoll.
Thank you, Madam Speaker. And Representative Olson, there are like 3 lines in this bill, and I have each one of those changes memorized. The first 2 references talk about moving from a 2-year to a 4-year window for contract, and then the other one talks about a 50% premium increase, moving it down to a 20% premium increase. The question that I have, and I have not been able to search the answer out today, I'm hoping you can help the body with this, because I did get this question from a lot of my members today, and the question is this. In a private market plan, if you have a 2-year plan, would this particular bill apply to individual plans in the private sector that are 2 to 4 years? If the premiums go up by 20% or more in any given year, they could terminate that contract with a private provider.
Representative Olson.
So, Madam Speaker and Representative O'Driscoll, this is specifically for PEEP, which is a pool. We're not talking about the private insurance plans. So this is just for PEEP, and the hope is with the outcome is to stabilize the pool. And in staying in PEEP for 4 years is not the same as being obligated to be in a private contract with penalties and other things for private plans. So that would be a different set of changes. This is just for PEEP, just for the pool. This is a pool, not a private plan, right? And so statute 471.6161 already gives districts and employees the options to agree. If they were to agree, a district, we are actually just talking with Representative Bakeberg about this, that you still have the option if the employer and the employees decide to, with a private plan, have a 4-year plan, they can do that. So this is only for changing the PEEP pool.
Representative O'Driscoll.
Thank you, Madam Speaker, and thank you, Representative Olson, for that explanation. So it begs the second part of this question. If I am in a PEEP pool and I'm in a 2 to 4 year program and my premiums go up more than 20% in PEEP, if I understand, maybe I'm implying on this, that you would be able to, as a district or as an entity who's participating in the PEEP plan, get out anywhere in that 2 to 4 year period of time if your premiums went up more than 20%. Am I understanding that correct? If she could yield to that question,
She
please.
will yield. Representative Olson.
Yes, Madam Speaker. Representative O'Driscoll, on lines 2.5 through 2.7 of the bill, it clearly states the literal only change in this bill is moving a 50 to a 20. So the ability to withdraw if premiums increase, it's just the change from the 50 to the 20 from 1 year to the next, and you can withdraw.
Representative O'Driscoll.
Thank you, Madam Speaker. And Representative Olson, I really appreciate that explanation. And I want to take it to the next chapter in the book for people on here. One of the things that we experienced in the state of Minnesota was when we adopted Obamacare and we had to, in the individual market, to take people with less underwriting ability, couldn't ask the questions to put people in the right pool and rating pool and different things. We saw insurance premiums absolutely skyrocket in this state. And what we ended up doing was we put a program in place called reinsurance. And we found out is the longer we had that reinsurance program on the books, not necessarily where you're tacking 2 years to 2 years to 3 years, where we said, you know what, this is going to be a 3-year run on this. You know what happened to premiums? They became stabilized as a result of that. Now, you may say to yourself, well, that sounds like a good idea with a 2 years to 4 year plan with PEEP. Here's the other dirty little secret that's not being discussed in this bill, and that is the fact that when you go to an insurance company, they will do their best that they can to kind of figure out your usage on this, and you'll get a 1-year premium. And then what happens is the second or third year in that, when they get a benchmark on your usage and the type of use that you have and the cost, premiums then reflect accordingly on that. Reducing the premium increase from 50% down to 20%, I'm here just to tell you that just puts you in line right now with what's happening in the market. So literally a district made for a year, pop into a PEEP plan, pop out of that again under this provision, and go somewhere else. The fact that we're moving this out from 2 years to 4 years, really from an actuarial standpoint, is only good if the people can stay in the plan or required to stay in the plan so that the insurance company can get a benchmark and stabilize the premiums over a period of time because they know what their cost and usage is going to be. By putting the second provision in, which is the 20% provision, that's the back door. That allows everybody to open up and literally walk out of this plan. Now, if you're coming from a part of the state where your school district is having a difficult time maintaining insurance, this PEEP bill doesn't really do anything. It's window dressing. Literally window dressing to be able to say, well, we did something. We extended from 2 years to 4 years your ability to contract with the PEEP pool. And we said if premiums go up more than 20% instead of 50%, you can get out. To go where? Seriously, folks, to go where? The Democrats right now are cutting back on the reinsurance program in the private sector. Are we going to create a reinsurance program for the PEEP plan? Because it's PEEP and it's not the private sector? Or are we going to go back and extend the reinsurance program and now add school districts who are in there to the reinsurance pool? Insurance is a game of numbers. The more numbers you have, the easier it is to be able to figure out what the cost of premiums are. So if you're a school district that has 50 people who are covered under the insurance plan, it's a lot more difficult to be able to calculate premiums versus 5,000 people if you happen to be the Anoka-Hennepin School District. One person who has a major catastrophic event in a district with 50 people covered under the plan are going to see a massive increase in premiums. You will still see an increase in premiums in that 5,000 pool in Anoka-Hennepin, or excuse me, in the Anoka-Hennepin County School District. But it's diluted by the 4,999 other people. Insurance is a game of numbers. And if you want to be able to go back to your district and talk to your people and say, we did something, we changed 3 lines in a statute, what does it do for you? Not a lot. Not a lot. So just keep that in mind when someone who knows insurance comes up to you and says, in your district, and trust me, if you've ever been on negotiations, the thing that teachers know and the negotiators know better than their regular licensed profession is how insurance works. Because that is the #1 thing at the table right now when you're negotiating. It's literally not wages, it's the cost of insurance. Let's not go back and tell people we did a great thing. Just go back and tell people you changed 3 lines and moved the chairs around a little bit on the patio for spring, just before we adjourn for the year, because that's literally what this is doing. And to make sure that we don't tie and keep the school districts in the PEEP program, we'll let you out of the kind of the average 20% premium increase, which again, I'd be willing to bet that every school district in the state of Minnesota, if they're in a 4-year commitment with PEEP, is going to be able to get out if they hadn't gotten out or chose not to get involved. Members, the right answer on this is voting no. If we really want to resolve the issue in Minnesota about health insurance for the different areas, let's work across the aisle as we have done in the past on this. The reinsurance program has helped a lot of people. Insurance is a game of numbers. Add those two things together and see what you come up with. Thank you, members. Thank you, Madam Speaker.
Further discussion to the bill? Seeing none, the clerk will take the roll on the bill. Will the clerk please call the names of the members who are voting remotely?
Becker Finn.
Becker Finn, aye.
Becker Finn, aye. Carroll.
Carroll, aye.
Carroll, aye. Cagle.
Cagle, aye.
Cagle, aye. Vang.
Vang, aye.
Vang, aye.
The clerk will close the roll. There being 78 ayes and 52 nays, the bill is passed and its title agreed to.